First, thank you all for coming here. Mel, thank you for the conversation. I'm looking forward to this evening. Let me begin my opening statement by giving you some facts about the state of the healthcare situation in this country prior to the passage of the Affordable Care Act. An American dies every 20 minutes for lack of healthcare coverage. There are 40 million uninsured Americans. That number will be 54 million if nothing changes by 2019. 33% of American adults report avoiding needed medical care because of the costs. And then that leads to having more expensive care later because things have exacerbated, or in terrible cases, things turn cancerous and untreatable. We spend more than any other country on healthcare, over $2 trillion per year, yet our outcomes are among the worst, 25th to 33rd among all the industrialized nations in terms of our healthcare outcomes. 1 out of every $6 is spent on healthcare costs right now. If we do nothing, if we say no to Obamacare, then we will have 33% of our nation's GDP spent on healthcare in 30 years. Without Obamacare, the cost of an average family premium is projected to rise over $22,000 in the next 10 years, and then each year nearly 1 million people will face bankruptcy because of medical costs. The situation is particularly acute for women. Before Obamacare, women paid nearly 70% more for out-of-pocket medical costs than men. Insurance companies could deny coverage to women for a pre-existing condition, which would include things like a C-section or a pregnancy. Insurance companies could also deny medical coverage for people for filling out a form incorrectly, or if they have medical treatment for sex abuse or domestic abuse, things that you don't control, obviously, and even for something like arthritis, which impacts 21 million Americans. That's considered a pre-existing condition, or was, prior to the passage of the Affordable.
About 1 minute left.
Now, President Obama, during the deliberation, if you look at the written text and set aside the oral discourse that I'm sure Mel will bring up regarding promises and keeping your doctors, period, which will be tough to defend. But focusing on what was written down, President Obama called for 3 principles under the Affordable Care Act debate. First, lower the costs of health care. Obamacare will do that by being fully paid for in 10 years and not adding a penny to the deficit. Number 2, the goal is to guarantee a choice of doctors and plans. That was the language that was used. And Obamacare does that by providing an insurance marketplace that contains a number of insurance plans that people can choose from. And then third, assure affordable health care for every American. Now, Obamacare will lead to 95% universal coverage. There will be subsidies available to help people buy insurance if they cannot afford it on their own. And in any case, no one will be taxed if they refuse to get health care more than 8% of their income.
And I must call time. Thank you.
Well, nobody on my side denies that there were problems with health care in America before the Affordable Care Act. The question is, what were those problems? And what was the best way to address them? Now, Ken started out by citing some statistics. As a sociologist, I know something about statistics. There's a wonderful book called Damned Lies and Statistics. If you've been listening to President Obama and his shills, if I may use that word, you will hear all kinds of glorious figures about what's happened and what's going to happen, and I hope you notice that they have not been borne out in reality. You have also heard promises. Promises, promises, and promises. Ken told us about the wonderful things that are going to happen in the next 10 years or so under Obamacare. Well, you know, as Ken himself alluded to, the president made some promises that did not quite come true. Just because you say how wonderful things are doesn't mean that's the way they're going to be. Ken also said something about the debates leading up to Obamacare. The fact is, there was no debate. The fact is that the Republicans, not one of whom voted for this, were closed out of the room. If you may remember, President Obama promised that his was going to be a transparent administration. The debates were going to be on C-SPAN. Everyone was going to see, because it was going to be out in the open. It was no such thing. It was behind closed doors with all kinds of kickbacks and political machinations. One of the things that did not get included in Obamacare was tort reform. Well now, why did not that happen? It's because among the biggest contributors to the Democratic Party are trial lawyers who were adamantly against it. And even Howard Dean admitted that that was the reason it would never get into the Obamacare Act.
About 1 minute, please.
Right. The question then is, what are we going to do about things? And again, the assumption seems to be that because we have Obamacare, we have to start with that as our starting point and make modifications, even though the president and his people are resisting them mightily. You will hear the Democrats say time and time again that Republicans and conservatives have no ideas, that it is only liberals who want to fix what is broken, and therefore only their ideas that should be considered. The fact is that conservatives and Republicans have had many ideas, and still have many ideas. For one thing, I would start with tort reform because it's relatively easy to do, and even though Obama said it would not fix everything, and he was right about that, it can fix things at genuinely lower costs. Not say, as Obama said, we're going to save you $2,500 per family and then wind up costing you $2,500 more. That's a difference. That's a swing of $5,000.
Thank you, Dr. Fein. Apologize, I do need to be a little intrusive in this role, and we now move to the format in which each speaker will have 2 minutes to begin, a 2-minute rebuttal, and then a 1-minute rebuttal. With the debater's consent, is it best I'll give you 1 minute warning so you know that you're about halfway through the 2, okay? All right, with that in mind and sticking with the format, Dr. Fein, you begin.
The question is?
The question is, I've got to get my clock reset, sorry. Will Obamacare improve healthcare outcomes?
Obamacare will disastrously injure health outcomes. Consider this. Though Obamacare is supposed to bring in many, many more people to the healthcare umbrella, more than that, it is supposed to give them many, many more services than they had previously. It is supposed to do this with no increase in the number of doctors, and there's a likelihood that the number of doctors will decrease. Now, when the demand goes up and the supply remains static, something has to give. Prices rise, or you get restrictions of various sorts. I learned this in high school. Apparently, Barack Obama and his minions did not. This is simple economics. Therefore, what's likely to happen is we're probably going to get a 2-tier healthcare system where the healthy and the middle class are able to afford good care, and where the poor, the ones that Obamacare was designed to help, will get the leftovers. Something that's what, remember, we already had assistance for the poor, and the problem is it was not good health care. Well, you know what? Putting more people into Medicaid, as we are doing, is not really likely to make things much better. And oh, by the way, as a sociologist, I can tell you, good health care doesn't merely depend upon giving people programs. It depends upon how people use those programs. And there will continue to be class differences in how that happens. So the way I see it is, poor people are going to get left farther and farther behind. And oh, by the way, many, many of them will die unnecessarily.
Thank you, Dr. Fein. I appreciate that ending right there. This is not easy. Dr. White, you now have 2 minutes for rebuttal.
So the question is, will Obamacare improve healthcare outcomes? I think the answer is yes, and it will do this in at least 2 ways, probably 3. First, one of the parts of Obamacare is that it mandates free preventative care. So people will have access because they'll have coverage, and because the services are provided, they will be able to go see their doctor early on and be able to avoid negative healthcare outcomes long into the future. So I think we'll see better outcomes by getting preventative care. And then you'll get better healthcare outcomes simply because people have coverage when they need it and when ill. If you have approximately 30% of the population not wanting to get healthcare because of the cost, that exacerbates the quality of their healthcare later on, because they're putting things off and tumors grow and things fester, as it were, and then what could start as a small thing is manifested into a much larger thing.
1 minute.
But if you take that 40 million and soon 50 million people who don't have health coverage at all, and then they have coverage, I think it's common sense that their health care outcomes will improve because they'll go have the opportunity to see a doctor. When we talk to people about their Medicaid coverage, part of the Obamacare program is to increase people, especially on the lower end of the socioeconomic scale, into the Medicaid program. They like it. They're happy with their doctors. So I would argue that we're going to see better healthcare outcomes because more people are going to have coverage, they're going to get preventative care, and they're going to get with a doctor that they like, and they'll be more willing to go see and be healthier as a result of it.
Thank you very much, and right on 2 minutes. We don't have extra prizes for that.
Get a minute now?
Yes, Dr. Fein, you now have 1 minute for rebuttal.
Well now, we've had the rollout of Obamacare, and as you know, it has been absolutely brilliant from start to end. This is the government controlling things. This is the government administering things. But do we really think putting this in the hands of government people who can't even count the number of people who are going to come into the system, that these folks are going to be able to deliver the services in the wonderful manner that is described? Well, I remind you, I'm a sociologist, and that means I'm an empiricist, and I look to history, I look to what has happened, and what happens when the government gets in control of things, including in health care, like in a place like England, where it really gets fouled up pretty bad.
20 seconds.
Pretty bad.
May I take that as your closing? Thank you very much. All right, the next question goes to Dr. White to start. Again, 2 minutes. And the question is, perhaps a nice transition here, will Obamacare bankrupt the United States?
So the answer is no. I think quite the opposite. The danger would be that you would have bankruptcy for the country without Obamacare, because the reason why the president addressed healthcare first is because it's an economic issue. That sick people can't work, they can't be productive, it has a disrupting effect on our economy, And the numbers indicate that we're looking at a third of our GDP going to healthcare costs if we don't address the skyrocketing costs that are the trend. Obamacare, according to the Congressional Budget Office, which is gospel as far as the debates in Washington, D.C., the law will pay for itself in 10 years and does not add a penny to the deficit.
1 minute.
I'll just say that this country is, by some accounts, in a post-consumer era, and so it's amazing that we might have to pay a little bit more for healthcare in some cases, although many people will end up paying less. We spend over $2 billion a year on pet products. People line up for the next Apple device. And here we're talking about healthcare, which is something that universally everybody needs, and that is much more important than a fluffy toy or the latest gadget. So we can afford to pay what we need to pay for healthcare coverage.
Thank you.
Strikes me that we've heard contradiction. We've heard, gee, we're going to lower the costs, and gee, we can afford to pay what we need to pay. So which is it? Are the costs going to go down, or are the costs going to go up? If we look at what's been happening right now, they have been going up dramatically. I mean, people's costs in their care, when their policies are canceled, have doubled and tripled, and if not the direct costs, the deductibles have gone to $12,000 and $20,000. I mean, my goodness, that's going to come out of people's pockets. That's real money. That is not bending the cost curve down, that's bending it further upward. And as for the projections of deficits, well, computer people have a saying, garbage in, garbage out. You put in mistaken data about your projections, and guess what? It comes out the way you want it, which is just what the Obama administration did. Rather dishonest, if you can believe that, dishonesty from Obama. Okay? It really looks like what's going to happen is the deficit will continue to climb. Remember, if we do nothing in terms of entitlements, irrespective of this new entitlement, there will come a time in 20 years or less when every single dollar paid into the government will go into paying for these entitlements and or for the debts that we have taken on as a result. There will come a time when simply paying the interest will push out everything else. Obama is fond of saying simple math. Simple math is if we don't fix this, if we don't change it, if we don't lower it, the projections are horrendous and they will destroy this country as we know it. This will not be an improvement. This will impoverish us in the name of being compassionate.
Thank you, Dr. Fein.
We have to be honest and we have to be intelligent.
Dr. White, you have 1 minute.
Thank you. Currently, 1 million people face bankruptcy each year because of medical costs. Without Obamacare, the cost of an average family premium would be projected to rise over $22,000 in the next 10 years. I went and looked at some of the subsidies. I think in the interest of honesty, it's true some people will pay more, but I also think that many will end up paying less. Part of the website rollout has been that people can't see the subsidies that are available to them, and that is a problem, but I don't think it's something that can't be fixed. The subsidies that are provided to people are fairly substantial. If your gross yearly income is less than $45,000 in a one-person household, then you would be eligible for subsidies. A family of 4 would qualify if their income is less than $94,000. So that is a whole lot of folks who are going to be able to take advantage of subsidies if they see that they can't afford the insurance plans in the marketplace.
Thank you, Dr. White.